So we're going to sort of go floor by floor so you can sort of see the highlights of what we're including with the project. Obviously, this is the first floor. This is the current parking lot A right out in front of the hospital, and it will continue to exist. However, most of it will be covered by the new ORs, as you'll see when we go on up to the second floor. We're only going to sacrifice a few spaces at the end of the day, but obviously during the construction period, we're going to have to close off most of that lot, which will present some parking challenges for us, but we'll show you further down in the presentation how we plan to address that. Shows sort of a new entrance down here, sort of to the corner. This is Parkwood, this is Kemble. So we're sort of moving the main entrance from here to here. We're going to have a nice little canopy for folks to, pick up, drop off so that they'll be protected from the weather. We also have discharge corridor, which is what we're working on right now. So once the covered parking opens back up in June, we'll actually be able to go back through and pick up, drop off patients here. It'll look slightly different because the emergency department's actually going to expand into some of that space. So the waiting room will be bigger. We're going to go from 35 exam spaces up to 50. That's depicted in here. The helipad ambulance entrance pretty much stays the same, but we're going to build new trauma rooms right here near the ambulance entrance. So those folks that need immediate services will be right through the door. We'll have our CT scanner and all of what's needed for trauma patients located in that vicinity. This green area are actually 10 beds that can be part of the ED. They can be observation beds. So we have some flexibility there that we can use them either way based on what our need is at the time. And then this shows that new elevator tower out there in the courtyard. That'll go all the way up to the 6th floor. So when patients are, it'll be a patient elevator, staff elevator. So we'll be able to go to both the St. Simon's Tower or the Glen Brunswick Tower all the way up to 6 with that elevator capability. This drills down on it just a little bit more, shows you a larger picture. Again, you can see the expanded size of the waiting area, covered parking, our new main entrance for the emergency care center, about where it is now, but it'll be rebuilt, of course. This is the second floor, sort of a big picture. So again, this is where the parking lot is, and this shows the 16 new ORs being built out over the parking lot. This green area is the SPD, which, as Tripp mentioned, currently is very old, and it's on the first floor. So right now we have to truck things up and down on elevators to get them to where we need them. They'll be adjacent to the OR, which we think is a good design. Creates a central core. As Tripp mentioned, they're also bigger rooms, so they'll be able to accommodate some of the newer equipment that we have. So our plan is build this first. Current ORs are back in here, and then we'll go back in and renovate this area to make more PACU spaces and more pre and post recovery spaces, which we also need, and that was shown through some of the work that we did preliminarily. So again, this is sort of a drill down of the pre and post and the PACU area. We also have the endoscopy area up here for inpatients, and those new ORs are down here, and that's the OR piece. So structurally, we're building this new area to accommodate really all the way up to 6th floor. So you've got, first floor isn't really a floor, it's parking, and then you've got this OR piece. On top of that, we're going to have a mechanical space. Now, both the mechanical space and the ORs are going to have higher ceilings than a typical floor. So by the time we get to the new patient unit, it'll actually connect on the 5th floor. So there really won't be a 4th floor per se, just for the sake of confusion. And so all of this has been, and then we're also preparing it structurally to add a 6th floor somewhere down the road. If we need it, we could add an additional 32-bed unit. What that's going to cause is the HR hallway that exists right over here is going to have to go, and we're planning on moving that down to the former Brock Strickland location at 2801 Parkwood. 3rd floor is pretty much, as Tripp mentioned, mechanical space down in here that will provide some infrastructure for us for what we're adding. And then 4th floor is sort of the ceiling of that space, since we have the higher ceilings there. And then we've got 4 St. Simon's here. Our plan is to renovate that, and the floor plan will look very similar to ortho spine because we don't need a rehab gym. It'll be a 32-bed unit, and you can see some of the finishes there on the boards to your right. On the 5th floor, again, this shows that new patient floor that we talked about. Again, our plan is to build that first so that we have the bed capacity during all the construction. As we take these other floors down to renovate them, we'll have enough beds, because this winter it was pretty tight, and that sort of convinced us that we probably needed to do that sooner rather than later. And while the cranes are here, and rather than disrupt the top of the OR later on, it sort of made sense to do that now. 6th floor, that just actually shows the very top of the elevator, because it will go all the way up to 6 Glen Brunswick. Then we have, this sort of shows the bed counts. Right now, today, we're staffed and can probably accommodate 250 patients. This shows a capacity of 260 with all of these projects being accomplished, which again, sort of jives with the Center for Healthcare Planning work that has been done.